Hello class. I'm going to go over the one section of the course that we were unable to do on, I believe it was the week of the April 11th, and this is all about urinary problems and chronic kidney disease. I did want to let you know that I have taken out nephrotic syndrome as a disease to review, as well as acute kidney injury, because those I have learned are going to be covered when you get to Adult Health 3. So we won't focus on those today. Primarily this will just deal with urinary problems, primarily around types of incontinence, and then end-stage kidney disease that we'll review in detail for more chronic type patients that have these problems. Of course, we've talked a little bit in the past about urinary tract infections and other risk factors that make patients more prone to urinary problems. Other diseases like diabetes, hypertension, and you'll see some more of that when we get to chronic kidney disease. Of course, health promotion things that are important for everybody for a healthy urinary system is to drink adequate amounts of fluids, keep your weight at a healthy level, maintain yourself in a situation where you're less likely to become diabetic, also not have the issues that come along with hypertension. If those can be avoided, because hypertension itself can cause, of course, the pressure to not work well with the kidneys, and then the kidneys themselves don't perfuse as well and cause stress on the kidney system in general. And then teaching patients how to maintain healthy voiding activities and taking in the right foods and fluids that support good urinary health. There are a few different types of incontinence that are listed in a very good table or chart that's in your book. You may want to look at that in addition to these slides just to kind of see more in detail. You may have a few questions on incontinence just to kind of recognize what type of incontinence this patient might be having, or good interventions that are prominently good for bladder training or treating some of these conditions. Stress incontinence is the first one of these. Most people know that stress incontinence is where when you're under stress, like jogging or downward gravity action, or just some physical activity that stresses you or stresses the body, you're likely to have urine come out unexpectedly. And this is really a condition kind of the musculature between the urethra that's not working as well. Thus, some of the interventions deal with keeping a journal to look at what kinds of stresses are causing this to occur. Some diet modifications they suggest for several of these types of incontinence to not have a high caffeine diet. And then they can do Kegel exercises, which are pelvic floor exercises that kind of help support the musculature to get back to a more strong stance where it can withstand those stressors and not have urine leak. Estrogen has been found to help in women. Stress incontinence is often more common in women because of childbirth also, and how that affects some of the musculature. There are some surgeries that can be done, and then vaginal cone therapy is another type of therapy that can kind of help strengthen those muscles with the resistance type system. Urge incontinence, you see this on TV all the time, talks about overactive bladder. It is the a situation where people feel like they have an extreme urge to go and they can barely get to the bathroom, and then urine will just leak out. Drugs that sometimes are given for this, one of the key ones is anticholinergics, to kind of decrease kind of bladder spasms that go along that are part of what causes this urge incontinence. And just remember, with anticholinergics, they also dry up the body. So, it's very common sometimes for somebody who's on those type of drugs to really can get dehydrated when they're older. So that's a key thing to ask. And when you're dealing with an older person that's had a history of bladder spasms and been on some of these medications, if they're looking like their BUN and creatinine is elevated, is that drug related because of the side effects, or what's really going on? So just remember that as a key thing as well. They can, of course, do exercises and bladder training, and electrical stimulation can also sometimes be helpful to kind of improve this. Overflow incontinence is also known as reflex incontinence, and this is really kind of where the bladder tends to stay full and just has some type of an obstruction that needs to be bypassed. So they will be really full, and then they'll just have some overflow that spills out. And so treatments for that can be surgery to kind of correct the obstruction, bladder compression, intermittent self-cath, and make sure that you really look at the procedure for self-catheterization. Be familiar with that. That is a nurse's responsibility to teach a patient to do safely, and you will see more information that you're going to need to review for that for test prep for the next test. And then just dealing with behavioral interventions that kind of help people recognize what kind of typical activity and lifestyle that they need to kind of adapt to deal with this kind of problem. Functional incontinence, is not a condition of the bladder itself. Most people need to have a level of cognition to be able to know how to control their bowel and bladder, and we learn this as a child cognitively. So in patients that have dementia, it's not always that there's a problem with their actual bladder. It is that cognitively they don't recognize how to maintain that control anymore. And so trying to figure out, what is the treatments and things that you can do. You can treat the reversible causes. If someone is incontinent because they're demented and that is not going to change, then the incontinence is not going to have an effective treatment that would be able to be corrected. And then other things that you can do is kind of figure out ways to contain the urine, protect the patient's skin, whether that is having a catheter as a last resort, have applied devices like a condom cath, and in some cases females have those type of devices as well, although they're not really the best and don't usually work as well. But there are some different ways to kind of deal with that. And of course we know the risk of urinary catheterization in terms of leaving somebody catheterized for a long period of time. But in the conditions with severe skin issues, that may be the only option that's left to someone. These are just a few case studies. You may want to review some of those just to kind of make sure that you understand some of the differences. So I won't go over those. I want to spend more time on the ones that deal with end-stage kidney or renal disease. All right, let's talk about chronic kidney disease. This is a slide that really talks about the frequency of this. 26 million American adults have this disease. 1 million more are at a high risk for developing it. This affects 1 in 9 Americans, so that is a very large number. And there are approximately, or a little over 500,000 Americans that are receiving treatment for chronic kidney disease, whether that be being on dialysis or getting a kidney transplant. End-stage renal or end-stage kidney disease on dialysis is a very, very high risk for mortality. You can see it's 19 to 24% because they're at the point where their kidney disease is severely damaging other body systems, and so the death is not just always a kidney-related death, but it is. And then there is risk, of course, with dialysis that we'll talk about as well. Causes of chronic kidney disease. We discussed this when we talked about diabetes many times, about how the diabetes affects the circulation to different parts of the body. And the kidneys are very susceptible to this because they really filter tons of blood. So there's, the amount of vascular system attached to the kidneys is immense. And so once the circulation to the kidneys are diminished or obstructed in any kind of way, there is death of the nephrons in the kidney, which is responsible for how the filtration is done, and so thus creating a situation where the kidney function, or what we call the glomerular filtration rate, is gradually decreasing and getting worse and worse. And as the diabetes gets worse or stays out of control, the more likely that damage is to continue to get significantly worse. The same thing is true for hypertension. You can see chronic kidney disease is 25% caused by hypertension, and it's for the very same reason. It is really how the effect of hypertension is causing damage to the vascular system. And then there are other causes like severe infections, acute kidney injury that you'll learn a little bit more about in the next semester for adult health. But just knowing that if you could take care of diabetes and hypertension, which we know those go somewhat hand in hand as well, you would have a significant less development of chronic kidney disease. So chronic kidney disease is progressive, meaning it's getting worse and worse. It's irreversible kidney injury, and the kidney will not recover. So it is a situation where it is getting progressively worse, and there's not anything that can be done to really recover it or slow it. And then you will see in records of patients end-stage kidney disease or end-stage renal disease, both of those kinds of abbreviations. So it may be ESKD or ESRD. So look for those when you're trying to review patients' chart. With this disease, you have a condition called azotemia, which means there is an increased BUN and creatinine levels, which is indicative of protein metabolism and, these metabolites from protein not being able to be excreted from the system. And the same thing is true for uremia, which is uric acid that is in the blood because uric acid cannot be removed from the body through the kidney system. And these are just some of the symptoms that you will see with that. Just a list of, they may have metallic taste in their mouth, they may have stomatitis, they may have nausea and vomiting, muscle cramps, a condition called uremic frost that I'm going to show you some pictures of. In their skin, they may have severe itching because of this, build up in their bloodstream in their skin, edema, dyspnea, and then you can kind of see the breakdown between chronic kidney and end stage in terms of the filtration rate.